Zyprexa Vial is a medication used to treat severe agitation associated with certain mental/mood conditions such as schizophrenia and bipolar mania. It works by helping to restore the balance of certain natural chemicals in the brain, known as neurotransmitters. It's important to talk to the doctor about the risks and benefits of treatment, especially when used in teenagers. It's also essential to follow the doctor's instructions and guidelines for the correct daily dosage and the best time to take this medication. Before using Zyprexa Vial, make sure to read the medication guide provided by your pharmacist. This medication is given by a slow, intramuscular injection, IM, by a healthcare professional. The dosage is based on your medical condition and response to therapy. Zyprexa Vial is intended for short-term control of acute agitation symptoms. If you require continuous treatment for your condition, your doctor may switch you to an oral medication. Some common side effects of Zyprexa Vial include dry mouth, constipation, nausea, dizziness, lightheadedness, stomach pain, weight gain, drowsiness, back pain, or redness/pain/swelling at the injection site. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. Dizziness and lightheadedness can increase the risk of falling, so be careful when getting up from a sitting or lying position. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects for most people. However, some serious side effects can occur, such as agitation, confusion, slow heartbeat, restlessness, weakness, numbness or tingling of hands or feet, tremor, yellowing of the eyes or skin, severe stomach/abdominal pain, difficulty swallowing, trouble urinating, interrupted breathing during sleep, or seizures. Zyprexa Vial may also cause a rise in blood sugar levels, significant weight gain, and a rise in blood cholesterol levels, especially in teenagers, which may increase the risk for developing heart disease. Rare but serious conditions include neuroleptic malignant syndrome, NMS, and tardive dyskinesia. Symptoms of NMS include fever, muscle stiffness/pain/tenderness/weakness, severe tiredness, severe confusion, sweating, fast/irregular heartbeat, dark urine, and signs of kidney problems. Tardive dyskinesia may cause unusual or uncontrolled movements, especially of the face or tongue. In rare instances, Zyprexa Vial may also increase prolactin levels, leading to unwanted breast milk production, menstrual period stopping, difficulty becoming pregnant, for females, and decreased sexual ability, inability to produce sperm, or enlarged breasts, for males. If you notice any symptoms of a serious allergic reaction, such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. And if you notice any other effects not listed here, contact your doctor or pharmacist. As with many medications, there are some potential risks associated with Zyprexa Vial, particularly for older adults with dementia. There is a slightly increased risk of serious, possibly fatal side effects such as stroke, heart failure, fast/irregular heartbeat, and pneumonia. It's important to note that this medication is not approved for the treatment of dementia-related behavior problems. It's crucial for individuals to discuss the potential risks and benefits of this medication with their doctor, as well as explore other effective and possibly safer treatments for dementia-related behavior problems. Always consult with a healthcare professional for personalized advice and guidance. Before taking Zyprexa Vial, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have liver problems, dementia, seizures, difficulty urinating, glaucoma, stomach/intestinal issues, difficulty swallowing, or a history of diabetes, heart disease, or breathing trouble during sleep. It's important to note that Zyprexa Vial may cause dizziness or drowsiness, and using alcohol or marijuana can intensify these effects. It's best to avoid driving or operating machinery until you know how this medication affects you. Additionally, be cautious of overheating, especially during hot weather, as this medication may make you sweat less and increase your risk of heat stroke. Teenagers and older adults may be more sensitive to the side effects of Zyprexa Vial, so it's essential to discuss these concerns with your doctor. If you are pregnant or planning to become pregnant, it's crucial to weigh the benefits and risks of using this medication with your doctor. This drug can also pass into breast milk, so it's important to consult with your doctor before breastfeeding while taking Zyprexa Vial. And remember, untreated mental/mood problems can be serious, so do not stop taking this medication without consulting your doctor. It's important to be aware of potential drug interactions with Zyprexa Vial. This medication may interact with other drugs, changing how they work or increasing the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Zyprexa Vial is metoclopramide. It's important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Always check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. If you have any concerns, be sure to ask your pharmacist about using those products safely. If someone has taken too much Zyprexa Vial and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222, and for Canada residents, you can call a provincial poison control center. Symptoms of overdose may include severe drowsiness, difficulty speaking, slowed breathing, or seizures. It is important to regularly undergo lab and medical tests, such as fasting blood sugar, weight, blood pressure, blood cholesterol and triglyceride levels, as well as liver function tests while using Zyprexa Vial. Make sure to keep all your medical and lab appointments. Zyprexa Vial is a medication used to treat certain mental/mood conditions such as schizophrenia and bipolar disorder. It can help decrease hallucinations, improve concentration, and help you to think more clearly and positively. This medication is given by injection into a muscle by a healthcare professional. It is usually given as directed by the doctor, usually every 2 to 4 weeks. The dosage is based on your medical condition, response to treatment, age, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. To reduce your risk of side effects, such as drowsiness, low blood pressure, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Follow your doctor's instructions carefully. Take this medication regularly to get the most benefit from it. To help you remember, mark your calendar to keep track of when to receive the injections. This medication is administered in a hospital setting and should not be kept at home. It is used to treat certain mental/mood conditions such as schizophrenia and bipolar disorder. The dosage and frequency of administration will be determined by the healthcare professional based on the individual's specific condition and response to treatment. It is important to follow the healthcare professional's instructions carefully. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.